You've probably heard of medications like Xanax or Valium, right? They're super common for treating things like anxiety or trouble sleeping. But here's the thing. They have a really complex and frankly risky side, especially when they cross paths with the world of surgery. Okay, let's get into it.
All right, let's kick things off with a number that really frames this whole conversation. 1 in 20. Before I even tell you what that means, just think about it. In any group of 20 people, that's one person. It's a pretty big slice of the pie. So what are we actually talking about here?
Well, that number, 1 in 20, that was the portion of Americans who filled a prescription for a benzodiazepine back in 2013. It just gives you an idea of the incredible scale we're dealing with. And this isn't some rare, niche medication. But, that prevalence, that's really just the beginning of the story.
So we've established just how widespread these drugs are. But there's another number we need to look at. And this one is, well, it's a bit more concerning. Number 3.
Yup. That's where benzodiazepines ranked among the most commonly misused prescription drugs just a few years later in 2017. So think about that. We go from widespread use to widespread misuse in just a handful of years. And this is where things start to get really complicated.
So to really get a handle on the risks, we first have to understand how these drugs actually work. And it all comes down to some pretty fascinating brain chemistry.
Okay, let's meet the main player here, a neurotransmitter called GABA. You can think of GABA as the brain's main off switch. Its whole job is to slow things down and put the brakes on, producing a calming effect. It's the natural system that keeps your brain from just racing out of control. And this is how that braking system works in your brain, right? So the GABA molecule docks onto a receptor, and that opens up a little gate. This gate lets in negative ions, which makes the brain cell less likely to fire off a signal. It's a really simple, elegant way of keeping things calm. And this is what a benzodiazepine does. It's so clever, really. It doesn't pretend to be GABA. Instead, it grabs onto a totally different spot on that same receptor and acts like a turbocharger. It makes the receptor way more sensitive to the GABA that's already there, essentially slamming that brake pedal to the floor and seriously amping up the calming effect.
Now, the drugs that use this little trick generally fall into 3 main buckets. You've got your classic benzodiazepines, the Xanaxes and Valiums of the world. Then there are these so-called Z drugs, which are newer sleep aids like Ambien. And maybe surprisingly, some skeletal muscle relaxants like Flexeril are also in this family, because they also work by depressing the central nervous system.
Okay, so what in the world does all this brain chemistry have to do with getting a knee replacement or fixing a broken bone? Well, it turns out the world of orthopedics is a place where these drugs show up pretty frequently, and for some very specific reasons.
I mean, it makes sense. Surgeons use them to help calm a patient's nerves before a big operation, or to help with sedation for a smaller procedure. They can help you sleep after surgery, and they're even used as part of a strategy to try and cut down on how many opioids a patient might need for pain. On the surface, it all seems perfectly logical.
But, and this is a big but, this is where that delicate balance can start to tip. The very same thing that makes these drugs so helpful is also what makes them potentially dangerous. Just look at this side by side. On the left, you've got everything you want the drug to do. Less anxiety, better sleep, relaxed muscles. But on the right, that's the price you might pay. The very sedation that calms you down can lead to a higher risk of falls and, ironically, fractures. It can cause confusion after surgery, memory problems, dizziness, and, of course, a very real risk of dependence.
And here is the absolutely crucial point. These risks aren't the same for everybody. For older patients, who make up a huge portion of orthopedic surgery patients, the danger is magnified. They're already more likely to fall, to get confused, and to suffer the exact kinds of hip fractures that brought them to the surgeon in the first place.
Now we've got to zoom out for a second, because none of this is happening in a vacuum. It's happening right in the middle of another massive public health crisis, the opioid epidemic. And when these two worlds collide, it is incredibly dangerous.
This quote from the source material just lays it bare. Taking a benzodiazepine can actually make it more likely that a patient will use opioids for a longer time and even develop an addiction. So instead of being a safe alternative, they can sometimes act as a gateway.
And this chart, wow! This shows you the devastating results. Back in 1999, less than 9% of people who died from an opioid overdose also had a benzodiazepine in their system. Fast forward to 2017, and that number jumps all the way to 21%. That is a huge leap, and it shows just how deadly this combination has become.
And in today's crisis, the threat is even more terrifying.
By 2020, 2/3 of all overdose deaths involving benzodiazepines also involve the incredibly potent opioid, fentanyl. See, both drugs suppress your breathing, and when you take them together, their effects don't just add up, they multiply.
And beyond the absolutely tragic human cost, there's a real, measurable financial cost to the healthcare system too. All of these complications we're talking about, well, they aren't free. They mean longer hospital stays and more complex treatments. So what does that look like in dollars and cents? Check out this number.
That's the extra cost to the healthcare system for a single patient, just in the month surrounding their surgery if they were already using benzodiazepines beforehand. It's a clear financial signal that things are getting more complicated and care is getting more intensive for these patients.
So what's the response to all this? Well, the good news is people are taking notice. The FDA has slapped its most serious black box warning on these drugs. States have programs that help doctors see what other prescriptions a patient has. And there's just a lot more awareness among surgeons now about how risky it can be to prescribe these drugs together. These are all really important steps.
Which brings us to the most important point of all. This isn't just about doctors and rules. It's about you. It's about being your own best advocate. Understanding these risks is what allows you to really participate in your own care. So the question we want to leave you with is this. If you or someone you love is facing surgery and one of these medications is on the table, what questions should you be asking? How can you have an honest conversation about the real risks, the real benefits, and maybe what the alternatives are?